Welcome to OptNow, Know Your Health Risk Better platform. OptNow enables better interaction between healthcare providers, doctors, and patients, making access to organized medical collaboration easy and seamless. Our platform provides portals for patients, clinics, and doctors where they can register themselves. As for the patient sign up, we can see that a range of socio-cultural details is taken along with the relevant information. Now we will try to log into the system as a mental illness patient. As patients visit our website, we welcome them with a quote or a health tip. We customize this specifically to the diagnosis of every user. For example, we would display various self help techniques for a person undergoing severe mental illness to cope with it. We believe that if users keep reading health tips or positive messages frequently, their subconscious mind gets influenced and they will implement these recommendations in their life, thereby improving their being. Users can assess their risk of diagnosis by updating entries corresponding to their glucose sugar level, heartbeat, and many more. Not only confined to that, we allow users to describe their conditions, allergies, and reactions in the form of text. Following any update in the database corresponding to a user, the app triggers the model to evaluate the risk. As we can see, since the patient did not specify any descriptions corresponding to allergy, he isn't advised further to take any suitable measures. However, the model recommends a checkup to diagnose physical pains since timely and effective outpatient care can help reduce rehospitalization risks by preventing an illness onset. Online consultation for healthcare has increased by 500% over the last year. Considering that, we decided to make the process as virtual as possible. The user can then book an appointment with one of the nearest doctors from his current locations. From a patient's perspective, we aim to bring as much transparency by providing access to the number of treatments carried out by the doctor and the estimated cost of the treatment. The user can then book the appointment by specifying the necessary details.
Now the patient will wait for the doctor to prescribe.
Now we have logged in into the system as the doctor. The doctor can see her scheduled appointments and the patient's relevant descriptions such as the contact number, illness of the patient, and the timings of the appointment. The doctor can generate a medical record consisting of entries corresponding to medications, tests, and the procedures for the treatment. This report will now be available at the patient's end.
So now we are on the patient's side. So after booking an appointment to a specific doctor, now we can see that the user has access to the medical report generated by the doctor. We can also view the detailed reports which consist of medications, procedures for the treatment, and recommended tests. To purchase the recommended medicines or to get the test conducted, the patient can access the medicine stores and the diagnostic labs which are nearest to his current registered location. The patient can also provide feedback to the doctor since it has critical insight that help in decision making and streamlining the patient experience. Now we can provide here the feedback. I am properly informed about my health and care. The doctor was friendly, but the charges were high. Now the feedback will be sent to the doctor's side.
Now we are back at the doctor's end for feedback analysis. On average, a general family physician gets 10 consultations in an hour. It makes it difficult for the doctor to interpret so much feedback. For this reason, we enable the doctor to analyze the feedback in the form of a word cloud, allowing them to better understand the needs and the requirements of the patient in less time. From this word cloud, we can interpret that the doctor is friendly and caring. Along with that, we can also infer that plenty of people have been talking highly about the charges by the doctor. Overall, it allows the doctor to assess himself better.
Now, I will briefly describe the techniques that we utilized while creating the model. We started by doing feature selection on the patient's dataset. We tried to predict the condition of the patient by mapping it to one of the 5 major encounter classes, which are emergency, ambulatory, inpatient, outpatient, and wellness, using various features. We performed text cleaning on various descriptive features. As we can observe, the modified descriptions are more descriptive of the diagnosis. Later on, we applied term frequency, inverse document frequency statistical technique on the words generated from the description. This is the observation tables that corresponds to various observations of patient made during the encounter, ranging from BMI, body weight, glucose sugar level, and many more. While doing the exploratory data analysis, we discovered that we have many entries that were corresponding to the wellness class and a very few of the others. This was the data imbalance problem, and it was undermining the performance of our machine learning model. We utilized the library for proper sampling of our dataset. It works by undersampling the majority class and oversampling the minority class to account for the imbalance. In the end, we were able to achieve the average accuracy of 95.8% of both the models.